Hello and welcome to another digital bulletin on the Omicron situation in the country. I'm Milan Sharma. First, let's look at the top updates on this new variant. Now, currently, India is recording about 358 cases of the Omicron variant. The number continues to surge with states like Maharashtra as well as Delhi, Rajasthan, Tamil Nadu being the contributors to the Omicron surge. Strict restrictions have been put in place in most of these states. In the latest from the Health Ministry, we have updates from the COVID-19 briefing of the Health Ministry. The ministry has analysed about 183 Omicron samples and have said that about 44 of them did not even have an international travel history, but did have contacts with some. Of these, there were some samples, about 18, where no contact or travel history was found. But most important, 3 such samples of Omicron did not have any information on them, but they tested positive even after being boosted. Let's listen in to what Union Health Secretary Rajesh Bhushan and VK Paul said.
An analysis of 183 cases that has been done. 183 Omicron positive cases. So out of these 183 cases that were analyzed, we found 121 had foreign travel history. वैक्सीनेशन स्टेटस एक महत्वपूर्ण आंकड़ा है. इन 183 में से 87 लोग फुली वैक्सीनेटेड थे और 3 लोग ऐसे थे जिनको कि 3 डोज मिली हुई थी. इन 3 मामलों में से 2 मामले दिल्ली में और 1 मामला मुंबई में पाया गया है.
न्यू ईयर है और हम देख रहे हैं कि इसी में ही ये नई मुसीबत की एक शंका हो रही है. तो इसमें निर्देशों के मुताबिक, गाइडलाइंस के मुताबिक म्यूनिसिपैलिटी लेवल पे, डिस्ट्रिक्ट लेवल पे, स्टेट लेवल पे गाइडलाइंस प्रोवाइड की गई हैं कि आप इस रिस्ट्रिक्शंस को इम्पोज कर सकते हैं. इसका एग्जांपल एक है कि गैदरिंग्स नहीं हो. दूसरा अच्छा एग्जांपल है कि नाइट कर्फ्यू हो. कुछ राज्यों ने इसको इन्वोक किया है, कुछ कहूँगा कईयों ने करा है.
And while there have been details coming in from vaccine manufacturers on their vaccine effectiveness and efficacy, we have very little data yet on how Covaxin could work against the Omicron variant and whether Covaxin takers would also require boosters in India. Listen in to what Dr. Balram Bhargav, Director General ICMR, had to say on this.
Both ICMR and DBT have been working continuously to culture the virus. Initially, we had some difficulty in culturing and growing the virus. Now we have had some success in culturing the virus both at ICMR as well as DBT. And once we grow the virus, we have also the sera of Omicron infected individuals, Delta infected individuals, as well as the original strain. So we have that sera and we are testing the efficacy of the vaccine on these variants. And as soon as we have the results, we will present it to you without hesitation.
HSTI की तरफ से एक अच्छी स्टडी पब्लिश हुई थी जिसमें ये दर्शाया गया था कि कोविशील्ड के बाद में एंटीबॉडीज कैसे रहती हैं, टी सेल फंक्शन क्या होता है, जो काफ़ी हद तक रीअश्योर करता है इन द कॉन्टेक्स्ट ऑफ द डेल्टा. तो ये स्टडीज़ भी हैं एंड आई एम अवेयर दैट सम एकेडमिक ग्रुप्स आर ऑल्सो परस्यूइंग सच स्टडीज़, ऑल्सो लुकिंग एट स्टेटस ऑफ वेनिंग इम्यूनिटी विद बोथ द वैक्सीन. सो ऐसा नहीं है काम नहीं हो रहा है, वो सब उसके ऊपर सारी नज़र है. उस काम को तेज़ करने के लिए भी एफर्ट्स हो रहे हैं. इसीलिए हमने कहा है कि ये एक साइंटिफिक बेसिस के ऊपर है. जिस डॉक्यूमेंट को अभी कहा गया था WHO का, वो ये भी कहते हैं कि इंट्रोड्यूसिंग बूस्टर डोजेज शुड बी फर्मली एविडेंस ड्रिवन. और वही डॉक्यूमेंट ये भी कहता है कि देयर इज़ नो ब्लैंकेट general. WHO is currently not recommending the general vaccination of children. तो पूरी टोटलिटी में देखिए एक उसी फ्रेमवर्क से driven by science and driven by science that is applicable to our situation, driven by science which is applicable to our vaccines. What you read largely is about different platform vaccines.
And in recent restrictions and curbs imposed, the state of Uttar Pradesh, that will soon go into elections, has imposed a night curfew starting at 11 p.m. in the night to 5 a.m. in the morning. But they have also cut short on guests at weddings as political rallies continue in the state. My colleague Abhishek Mishra reports from Lucknow.
As the number of cases are increasing for Omicron, UP government has imposed the night curfew in Uttar Pradesh by 25th of December from night 11 p.m. to morning 5 a.m. At the same time, testing has been increased and there is imposed on the number of people attending the gathering, marriage or such ceremonies within 200. The number is also a major concern with the fact how the Omicron is taking its speed. Although in UP, the number is still in the single digit, but taking the fact that how the Christmas celebration and the New Year celebration, it is a major step the UP government has taken by imposing this night curfew. At the same time, instructions have been given to follow the COVID protocol properly. And at the same time, it has also been said that with the kind of number of cases which are increasing, it was indeed a major step with the BJP-led UP government has taken. Finally, it looks like that with the elections are also coming near and the question being raised about the public and political gathering, this night curfew in a way is a step to restrict the kind of situation and has been taken by the Yogi government in Uttar Pradesh. In Lucknow with cameraman Gaurav, Abhishek Mishra for India Today.
Meanwhile, questions are being raised on whether political gatherings and rallies should continue. The Allahabad High Court has appealed to the Prime Minister to stop such rallies and political meetings in the state, even as the state is slated to go into elections. We asked the Health Ministry on what their view is on this, and this is what they had to say.
जो 21 दिसंबर को भारत सरकार ने मानक टेम्पलेट जारी किया सभी राज्यों के लिए और उसके बाद राज्यों की बैठक कर उन्हें समझाया कि इसका इम्प्लीमेंटेशन कैसे किया जाना है, उसमें ये बहुत साफ शब्दों में लिखा गया है कि कोविड अप्रोप्रिएट बिहेवियर को कैसे इम्प्लीमेंट किया जाना है। उसमें ये भी लिखा हुआ है कि जो लार्ज गैदरिंग्स होती हैं उन्हें कैसे रेगुलेट किया जाना है। जहाँ तक माननीय उच्च न्यायालय का प्रश्न है या माननीय निर्वाचन आयोग का प्रश्न है, उस पर हम आप सहमत होंगे कि इस मंच पर कमेंट नहीं करना चाहेंगे।
Well, in a recent study that has been published in the Lancet, it was shown that AstraZeneca vaccine's immunity starts waning 3 months after giving a second dose. And there have been concerns about this, and since India is using Covishield as the vaccine in large populations, there is definitely some unanswered questions. And to tell us more about this, I have with me Dr. Rajeev Jayadevan, who is in the clinical research cell of the IMA and is from Kochi. Dr. Rajeev, thank you so much for joining us on this digital bulletin of India Today. First up, what is the problem with the Lancet study, and do you believe that it is misleading people when it's being interpreted that people who have taken AstraZeneca vaccines are less protected and require boosters right after 3 months of the second dose?
Yes, this study that was recently published in the Lancet has been widely quoted in the media, and it's been quoted verbatim. The author's conclusions are that the AstraZeneca vaccine is losing its efficacy really fast, including against severe disease. The problem is that this is just the author's conclusions. Remember that there is no perfect method to assess the effectiveness of a vaccine, especially because 2 years into the pandemic, the population is mixed with people who are vaccinated, unvaccinated, partially vaccinated, infected, and so on. But the methodology that these authors use has been widely criticized by many peers who believe that there are perhaps better methods of assessing a vaccine's effectiveness. Specifically, it is like they compared on a forward timeline, they compared the event rates in a vaccine group with the event rates in the same group in the beginning of the study. Now, that lends itself to plenty of erroneous conclusions. because the event rates that follow on a forward timeline will be influenced by the amount of the pandemic in a community, and also ignores the fact that the unvaccinated segment need to be compared with. So there are plenty of methodological quirks in the study. Well, we are aware that it's published, but many of us do not believe that this methodology reliably measures vaccine effectiveness. Now, we know that AstraZeneca's vaccine is excellent in providing protection, especially from severe disease and death in the long term. But we do know that all vaccines lose their lose their effectiveness to some extent against prevention of infection and transmission within the first few months of giving the second dose. And that's well known. But the two are different situations. This particular study claims that effectiveness against severe disease is waning according to their calculation, which many of us disagree with.
So you're saying that you don't agree with this particular study, am I right?
Yes, as I mentioned, a study can be done based on different parameters. Like, for example, for our viewers, to make it very simple for our viewers, I'll give you an example. If you want to assess a student's performance in a particular school year, let's say the student gets 90% marks in the first exam, 70 in the second, and 50 in the third. Now, does that mean that the student's performance declined? No, that doesn't mean like that, because it depends how tough the examination was. The second examination may have been more difficult, and the third may have been even more difficult. And the student may, in fact, have scored the highest marks in the class in the third exam. So unless you compare reliably with unvaccinated controls, you cannot come up with a ratio. In this study, what they did was they just looked at the first test paper, that is the first marks, and they concluded that 60 is worse than 90, and therefore the performance must have come down. So this is very different, and the methodology they used is very different. So obviously it's a published study, so we just have to give them credit for that, but we don't agree with their conclusions.
All right, Dr. Rajiv, thank you so much for joining us on this special bulletin. We look at the Omicron situation in the world right now, and it's going to be a muted Christmas as well as New Year celebration as cases continue to surge in the United Kingdom as well as in the United States. Especially in the United States of America, more than a dozen flights have been cancelled by airlines as Omicron is infecting staff there as well. The European nations and most of the Western world have reintroduced restrictions in their countries to contain the spread, even as somewhere we are looking at hospitalizations too. And that's all we have for you in this special bulletin of the Omicron. Here's wishing you a merry and a safe Christmas. Keep watching India Today and stay tuned to indiatoday.in.